Here's exactly how to use your RSO extract syringe. Hold the syringe firmly and twist the cap to open. The back end is the plunger. This controls your dose, and the front is the tip from which extract comes out. Gently push the plunger to release a small drop or recommended dosage. One drop is about the size of a grain. Push the plunger. Just take out one drop on your fingertip, place it under your tongue and hold it for 30 to 60 seconds. You can drink water after. Alternatively, dispense onto a spoon and take it sublingually. Dispense onto a spoon. You can mix it with coconut oil or olive oil for a smoother experience. And take it sublingually. For rectal or vaginal use, mix the recommended extract drops with 1 to 2 ml of carrier oil, then fill it into a disposable syringe. Always start low, go slow, and follow your recommended dosage.